Sometimes we all Ayurveda practitioners might have experienced an Ayurveda patient comes and he keeps on changing the doctor from one doctor to the other, and they'll not be satisfied with anyone. And ultimately, when they come to us, they will blame other Ayurveda practitioner or other Ayurveda doctor in front of us, and they will sometimes exaggeratedly prices. So, I mean, how to keep the balance, and how should be the Ayurveda doctor's approach when the patient is especially blaming the other Ayurveda doctor or other doctor from other fields.
So it's very important. Whenever a patient blames other doctor, don't feed him with the further positive or leading points so that he can go on blaming the other doctor. If in future, if he is not satisfied with your approach, then you will also be put to the same blame in front of the next doctor. So don't appreciate or entertain any person who tries to blame the other doctor in front of you. Don't accept that arguments and things. Politely, you keep aside. Okay, let me come to the point. What exactly you are suffering from? You please explain to me those points and anything required from the previous experiences of your treatment protocol. Let me take a document and I'll go through that. So unnecessarily, if you are telling anything regarding any, it may be positive or negative regarding any doctor, don't take it very seriously or don't give any advantage or points to that type of comments. Keep it aside, because patients, when they want to have a treatment with you, they may praise you like anything. Once they are out of your chamber, their time comes for the payment or something like that, then their approach will be different. And once the result is out, then their approach will be entirely different. So don't take it anything positive or negative from these type of praising or blaming games from the patients. You keep it aside. Concentrate on the clinical aspects and the points which we need to concentrate to give a best result out of us. So we need to understand that point. Unnecessarily, if a patient starts blaming the other doctor, you just cut short it and you just make him to come on to the real points where you want to discuss with or you want to take a consultation with me. So such type of things should be entertained.
Yeah, thank you very much, Jay sir. Yeah, better to ignore the conversation and stop it there, and move on with the actual purpose of the visit, which is to consult and get the advice from you. So that's an important point there. And another thing is that how to go about with the disease explanation. What is the root cause? What has happened to me? What's the root cause? How is my liver? What's the exact problem with the uterus? So it becomes so tricky sometimes to explain the disease. I mean, of course, we can give some hints that such and such thing is not working properly. But when the client wants to know more and more disease, but we do not have time, or sometimes explain more about the disease might cause fear in the patient's mind as well. So we need to hit a balance. So where does the balance stand, sir?
Usually, when a patient comes to us as a single entity, as a client, without any attendant side by side, then we need to careful while handling him or her be conveyed and what should not be conveyed. Something if it is very grave things is there, you just keep it aside. You just put it on the word with a soft words that there are certain issues. We'll keep it aside in the last issues, and we'll see in the next visits. See how it comes. The outcome of the treatment will be. We will take care of all those things. Like that, you have to just pass on those informations. If a patient is quite strong enough mentally to digest whatever may be the thing, then you try to explain with the real, exaggerate anything. Don't hype the prognosis, or it may be a bad prognosis, or it may be a good prognosis. Don't hype the things. Keep it as simple as it may be. You keep the terms in such a manner that patient will be convinced. So that is the one real approach to these things. Second thing, we need to take care while handling these patients. When they say that what happened to my liver or whatever, there are certain laboratory investigations and imaging techniques available to us. We can take the help of that, because If I say, see, if your eyes are yellow or something like that, very convincing things are there, then we can tell them. Or if it is something sluggish liver, patient has come to us with a lot of such issues with the digestion and all those things that he only experienced it. We can't tell him that you are having these problems because he only conveying us that I am having a digestion issues. So when such things are there, which cannot be just enhanced or what you call it, certified by our terms, better if such things to be required, then we may go for certain laboratory investigations to support our findings or his issues. So that can be taken, that part of can be taken care of in that sense. Then other words, the patient should be convinced that you might have done these things which may fall under the purview of what we call nidana in Ayurveda, maybe the causative factors. Maybe any one of these might have influenced you to get this disease. So that is the way we need to convince them. And many a times the patient say that I have not done anything, I have not done this, and I have not done whatever the leading clues you give. The same, all the leading clues will be just kept aside. No, I have not done, doctor. Still, I got this disease. Why? So this type of things will be very common. Then certain things are there. They are called sporadic diseases and iatrogenic diseases, and certain type of things are there, where sometimes maybe due to the age factor, sometimes maybe due to the genetic factors or autoimmune factors, or maybe nature of the disease. Certain times we may find some diseases which are not, we cannot give exact reason or for the causative things, but most of the times the general causative factors can be identified and it can be listed out to the patient so that can be avoided, because nidana parimarjana member chikitsa, the first line of treatment is that removing the nidanas. So that if you do it, then it will be definitely, it will be very good way of convincing. And of course, but we should not give any unnecessary assurances or even the prognosis. If it is too bad also, we should convey it in a very soft terms. It should not be hurting the sentiments and even the feelings and the consciousness of the patient. We should take care of those things. If any person who is accompanying the patient as an attendant, then you can send the patient out and you convey the information as it will be as genine. You can convey it to attendant regarding the prognosis and all those things. So that can be usually done. That is a better method of doing it.
Anyways, it's always better to keep the disease explanation part short and crisp with precise things without any exaggeration. So that's a good point taken there, sir.